part of the recording, then please log off now. Okay. Okay, well, thanks so much for coming. And next slide, please. Okay, I always like to start off with a test your knowledge questions. We have two little questions at the beginning, and I've been helping a lot with Kara with inspections, and Kyla is on here too, and she's been helping with inspections. And Kara has been noticing that people aren't having the items that should be in a first aid kit. So the question here is, during a health inspection, how many items should be in a first aid kit? And you can unmute yourself or just put it in the chat. Okay, and the answer is, dun, dun, dun. The answer is 9 items. So some of you are shaking your heads. You knew that. That's wonderful. And the most important part is that you store these in a place convenient for staff, for emergency use, and inaccessible to children. Next slide, please. So the first aid kits, and you'll see this as part of the CDPHE health regulations on page 21, the 9 items. You can read them there, and then you'll also all have access to these slides. So you may want to just cut and paste and copy this slide and put it up in your childcare facility. And Sining just put it in the chat as well. Okay, and our next question is, respiratory diseases coming up. And what 3 illnesses are we referring to when we talk about respiratory disease season? And respiratory disease season from an epidemiologist's point of view is from October to May. So which 3 illnesses do you think we're referring to? COVID, pertussis, flu, RSV, tuberculosis. You can put it in the chat or unmute. Or A, C, and D. Thank you for being brave. A, C, D. Okay, and Sining, what's the answer? A, C, and D. Okay, good job. And we'll be talking more about these respiratory illnesses coming up. Okay, the next slide. First of all, we just want to thank all of you for coming today. We have 28 people, which is wonderful. Thank you for taking time out of your busy day. And just thank you for all you do to keep our children healthy. You are really the people on the ground that just work so well with the children. So thank you so much. And if you ever notice in your facility that quite a few children are getting sick or have similar symptoms, the health ECE at bouldercounty.gov is the email address that you should email if you have questions. And I am one of the people, so Martha Hensis, one of the people that answers your questions. And then my partners, Sining Chan, who's our outbreak epidemiologist, also helps with that, answering those questions as well. Okay, today we will be, first of all, having a presentation by Dr. Katie Richardson about a wonderful resource called Bright by Text. Then I will be talking about how to partner for success with inspections, focusing on first aid kits, temperature charts, and a spill kit. And then Sining will be talking about communicable disease updates, the respiratory season update, S-Tech, reporting guidance, and then we'll have updates from our partners, ECCBC and CCAP, and then a summary of future meetings. So to begin with, I would like to introduce Katie Richardson, who has her own slides and will be presenting about Bright by Text. So go ahead and share your slides, Katie. Thank you.
Thank you for inviting me to present today. Um, I am getting it pulled up right now. All right. As Martha said, I'm Katie Richardson. I'm a pediatrician by background and training, and I've been in practice for over 20 years now. Crazy how quick the time goes. But in the last year and a half, about a year and a half ago, I took over as CEO of Bright by Text. So I am here with my Bright by Text hat on today, um, again, to tell you about this great program. I'm guessing some of you have heard about Bright by Text, but if not, I'm going to do a very quick and brief overview. Um, so Bright by Text actually began almost 30 years ago, so 1995 as Colorado Bright Beginnings. We've gone through several iterations from Bright Beginnings to Bright by 3 to now Bright by Text. So if you've heard of any of those entities, it's all the same organization. And it initially began by bringing together experts in the early childhood arena to create materials for home visitation programs. We are now fast forward to about 2014 when the Bright by Text team decided to develop a text messaging platform and take all of that amazing content that was developed for home visitation and put it into bite-sized nuggets to be delivered to the palms of caregivers' phones or hands. Again, as text messages. It's really difficult if you've ever tried it to figure out how much you can say in 140 characters or less. But we'll talk a little bit more about the additional linked content that comes along with every message. Fast forward to today, we serve not only Colorado, but all 50 states, and we actually have over 375,000 caregivers nationwide that are receiving Bright by Text messages and about 21,000 in the state of Colorado alone. I'm very excited to report that today we launched a new language. So Bright by Text is available in English, Spanish, and now Arabic. And that was in partnership with the Colorado Department of Early Childhood. So very exciting. I think probably you all, at least when you read it, are like, oh, yeah, that makes sense. Text messages are effective and equitable. What we know is 97% of adults have a mobile phone, 85% of those are smartphones. And for a lot of families, it is their only link to the internet. So we know that, again, 98% of all text messages are opened, read, and responded to, well, 95% of them within 3 minutes. So it's a great way to reach families. The other thing that Bright by Text is able to do is help reduce barriers to resources and services in the community. So really simple sign up process. Families, our Colorado and national keyword is bright. So families can text the word bright to 2744448. And all we ask for is either a due date or a date of birth, a zip code, and then again, just because we just launched Arabic today, we need to update our slide here. They will be able to choose their language preference, either English, Spanish, or Arabic at this point. On the right-hand side of the slide is just a web form, which is also available in multiple languages on the Bright by Text website. So families get anywhere between 2 to 5 messages a week, depending on the age of their child and where they live. In Colorado, we have a lot of community partnerships. And so a lot of the great resource messaging that's put into Bright by Text by our community partners gets up toward sometimes that 5 messages a week. But in general, it's 2 to 3. So each message is timed to a child's age and stage of development. And there's always a link to additional content to learn about why this is important. There might be a video or a photo that talks about the activity. And then at the bottom of each landing page is additional linked content. I'm going to go through this pretty quickly, but this gives you an example of what it might be like for a mom with 2 kids ages 4 and 1. I actually have a 19-year-old, so it's actually not my user experience. The type of content we deliver, 3 different types of content. One is age-based, again, in line with a child's age and stage of development, covering a wide variety of topics. The second is topic-based. So we have opt-in programs for families that may have different needs. One for families that might be worried their child has a speech delay. We have a new one called Hear for families with a child who is deaf or hard of hearing. I also will point out the Bond program, which is for parents with a child between the ages of 0 and 1. That although we say tips for taking care of yourself as a new parent and bonding with your baby, it's really all about identifying mental health challenges for new parents and where to look for help. We call it perinatal mental health in that arena, but really that's for parents with a child between ages 0 and 1. And then location-based messaging. This is where our community partners come into play. They're able to put information out about free and low-cost events, local events, and then resources like food banks, diaper banks, library story times, museum free days, etc. So opportunities for families. We support caregivers from prenatally through up to age 11 or through the age of 10 currently. Our hope in the future will be to expand that up to the age of 18. This gives you an idea of the types of topics that we cover, lots on developmental milestones, and what to do if you're concerned that your child has some sort of delay. Lots on health and wellness, as well as mental health and mental and overall well-being, I would say family well-being. But this just gives you an idea of the types, again, of topics that we cover. We have partnered from early days at Bright by Text with experts across the US, national experts, local experts on creating our content library. This gives you an idea of some of the national experts that we have partnered with to create our content. And we look mostly from an outcome perspective at what we call the 3 C's. So caregiver confidence, competence, and connections. So 82% indicate that Bright by Text helped them feel more confident and informed about their child's development. We also know that 89% of our subscribers have tried one of the positive parenting behaviors as a result of receiving a Bright by Text message. And 70% report that by receiving the messages, they have improved their bond with their child. 66% have been connected to a local resource that we have shared. This gives you, I'll stop after this slide, but this gives you an idea. We talk about the 5 protective factors and social determinants of health a lot. And this is just an example of the types of messages in both our age-based content and our location-based content that are going out to address each of these areas. So I'm going to stop there. Martha graciously gave me a short amount of time just to come talk about Bright by Text, but I want to see if there's any questions that folks have about the program. This, by the way, I probably didn't say it, but hopefully it doesn't need to be said. Bright by Text is free and will always be free for families. So again, there's no cost. There is what we would say text and data fees that may apply for some families, depending on the type of cell phone plan that they have. But otherwise, it is a free program. Questions from the group? I'm super excited, by the way. 30 people on this webinar is super exciting, all focused on the health and well-being of families in Boulder County. Super exciting.
Katie, do you mind dropping the keyword and the phone or the text number, I guess, into the chat as well for anyone who's joining later?
Super.
And you can please share this with any families that you come in contact with.
Super. Well, thank you so much, Dr. Richardson. I appreciate this. And one of the goals of our health ECE, we have quarterly meetings with Boulder County Public Health and the providers and partners. And our goal is to share resources which could be helpful to ECE directors, ECE staff, and then hopefully that will be shared in turn with families of children ages 0 to 6. So
wonderful. Thank you for having me.
Yeah,
Great to
thank you
meet all
so
of you.
much.
I'll put my email here in the chat. So if you have additional questions as well, please don't hesitate to reach out. But thanks for having me today.
Okay, thank you, Katie. Okay, keep your seatbelts on, everyone, because now we're jumping to inspections, and our goal is to partner with everyone for success. So last quarter, I shared a child care facility's guide to a successful inspection, and we spoke about sanitizers, which was the most often cited critical violation. And this time we're going to talk a little bit about first aid supplies and medication, and looking at the 9 items that are required in a first aid kit. So these are the items: gauze pads, rolled gauze, and with the rolled gauze, that's why we want to see the scissors in there as well, because it's hard just to rip that rolled gauze. Sometimes people ask, why do you need a scissor in there? But it's because of that rolled gauze, or even cutting the adhesive tape. Cold pack, plastic bags, disposable gloves, because we want to keep your staff safe as well if they are working with bodily fluids, Band-Aids. And then if you brought your first aid kit to a remote location, for example, if you went on a walk to a park, we'd want a mechanism for cleaning hands in a remote location. And note, these are what are suggested as part of CDPHE health regulations on page 21. Next slide. Another part of inspection is testing the temperature of your refrigerator. So as you all know, foods need to be held at a temperature below 41 degrees Fahrenheit or more. And so ideally, you should ensure that a thermometer is that you can see a thermometer when you open the refrigerator door. And the best place to put it is in the door. And I created a thermometer log that you could just post outside or on your refrigerator, and just make sure that at least one person is looking at the refrigeration temperature log daily and putting that number in there. Because if we come and the temperature is higher than 41 degrees, we'll want to know, how many hours has it been higher than 41 degrees? When you came in the morning, was it okay? So that's the importance of keeping that log. And you can also, we'll send, Seaning, put that in the chat as well if you want to print out that temperature log. And I liked the logo as well. Cold holding temperatures, 41 degrees Fahrenheit or below is good. And next slide. And just also, some of you prepare food for your children. And I really like this slide as well, to look at how should you properly store food in your refrigerator. And so the items at the top are your ready to eat cooked food, and then raw roast beefs, raw eggs, raw fish, raw pork, raw ground beef, and raw poultry. And the reason we want the ready to eat cooked food on the top is if an egg happened to break or some juices from some of your raw meats dripped down on your ready to eat food, we would want to make sure that they're not contaminated with any bacteria or viruses that could cause illness. Kyla asked if we have these food safety handouts in Spanish as well. I believe on our website, but I will look that up. Kyla, thank you so much for the question. Next slide, please. Then the topic is a spill kit. Okay, so spill kits. What would you do if there's an accident? I was actually at a health inspection last week, and one of the children threw up. And sometimes in those situations, it's important to have things available. And so a spill kit is not required by the regulations, but it can reduce exposure and help prevent other staff and children from getting sick. And It's especially important when a child vomits because vomit can aerosolize, which means disperse in the air, and other people could breathe that in and also become sick. And so people have asked Kara and I, what should we put in a spill kit? And as we were looking at all the different things that would be recommended, we then looked on Amazon and realized for $15 to $20, you could just order a pre-prepared spill kit. And again, notice this is all optional, but our goal is to make life easier for you and also to prevent the spill of diseases, or not the spill, the spread of diseases. Next slide, please. Okay, and Sining will take it away with communicable disease updates.
Yeah, thanks, Martha. All right, I am going to go over some communicable disease updates today. Like Martha mentioned, we'll be talking about respiratory season updates, some updates about STEC or Shiga toxin producing E. coli outbreaks that are going on nationally. And then what is the last thing we were talking about? Oh, reporting requirements as well for you all, just as a reminder. Alrighty, and I'm going to be chugging along, so if you have any questions, you can always unmute or you can put them in the chat as well. Alrighty, so respiratory season outlook. When I put these slides together, we were pre-respiratory season, but now we are pretty much in the first month of respiratory season here. The CDC every year does release a outlook or a prediction of what respiratory season is going to look like. So I put together a slide kind of going over that so you'll know what to expect for the rest of the season. Of course, nobody can predict the future, so this is not necessarily set in stone, but this is always good to know for you all, just to see what you should be looking out for. So CDC, as of, I think this was in September when they published this, but they did expect that the upcoming fall and winter season to have similar respiratory disease numbers and hospitalizations as last year. Like you all had put in the chat earlier, respiratory season includes COVID-19, influenza, and RSV when we're looking at it from an epidemiological standpoint. Different factors that could lead to differing numbers from these predictions include maybe a new COVID-19 variant that causes more severity or transmissibility, so it's more contagious or potentially results in more hospitalizations. A new influenza subtype or a different influenza subtype with more severe outcomes. Not sure exactly what you all know about how they create flu vaccines, but it is based on data from South America because they experienced their respiratory season before we do. We take the data from South America, and that's how they kind of develop and put together a flu vaccine that will be more effective in the United States. So that being said, even if you're vaccinated against the flu, if there is a change in the influenza subtype, it might be less effective, but that's not to say that it's not effective. You'll still see that it does still reduce severity of symptoms, so you'll have more mild illness. And then the last thing that can contribute to higher hospitalization rates are lower vaccine uptake. So as always, we always recommend that you get your updated flu vaccine. There is also an updated COVID vaccine as well for this season. And then RSV, I believe this season they are only recommending for individuals 75 and up, and then anyone 65 and up with immunocompromising conditions. So people who might be more susceptible to getting more severe illness from RSV. So to give you a better idea of what kind of respiratory illness is circulating right now, I wanted to share a few resources that I tend to look at when I'm looking at what's circulating. So if you guys are seeing more respiratory illness in your ECE, you might be curious, what might be causing this respiratory illness. And of course, it's not a diagnostic tool, but if we can use these resources, we can tell better what is circulating in our community right now. So these are all local resources. The first one that I'm going to share, and hopefully you all can see this, Martha, scream if, if that's not happening. But the first resource that I like to use is the Bug Watch. This one is released by Children's Hospital, so in Denver. So they have a better idea of kind of what's going on in our community because they are doing all the testing and stuff over there. And some of these viruses or actually, I guess there are a couple bacterias, but mostly viruses are not reportable to the health department or to the state health department. So we don't necessarily get those numbers, but Children's Hospital graciously publishes them for us. And so we're able to see kind of what's circulating recently. So if you are looking at these are published, I think, on Wednesdays every week. So they're updated on Wednesdays. And you can kind of see what is going on in the community. You can see here COVID-19 rates have been decreasing, which is great to hear. We can see RSV has gone up a little bit in the last few weeks, but it's not super high levels, just kind of giving an idea of what is circulating in the community. On top of that, this, of course, doesn't give us a real look at everybody who is testing positive for these things. This is just coming from Children's Hospital, and so it's a small subset of what tests actually look like. But this is a good, I guess, indicator, especially for the age groups that you all are working with. You can see here there are other respiratory pathogens that they detect as well. So other coronaviruses, parainfluenza, rhinovirus, enterovirus. Rhinovirus and enterovirus is always higher. That's what causes your common cold. So, you know, most people are getting those, and most people aren't testing for them. So, you know, really, they are testing mostly people that get hospitalized or are little kiddos that are getting hospitalized as well. And then not only does it do they publish respiratory pathogens, but they also publish data on enteric pathogens as well. So those are your pathogens that cause diarrhea, vomiting, etc. So you can see here, it's not specific pathogens that they're looking at, but they're looking at, you know, are they more bacterial? Are they most likely or viruses? So like norovirus and stuff like that is probably causing this increase you see here at the end, as we're seeing a little bit more norovirus outbreaks as we go into norovirus season. Let's see here. What is our next? The next one that I wanted to go over is CDPG's viral respiratory disease data dashboard. This one has a lot of information and, of course, is less maybe applicable to the settings that you all are working with because this is at a population level. So this is everybody that is getting hospitalized in the state of Colorado, but you can kind of see here these hospitalization rates kind of going up and down. You can tell last winter we saw them go up during respiratory season, so we will probably see similar patterns this year. As of right now, we're seeing mostly hospitalizations for COVID-19 and whatnot. There are also other tabs that you can kind of shuffle through here. It goes over respiratory deaths, different variants that are circulating for COVID-19, maybe an idea of outbreaks that are being reported to the state as well, but also a really good resource if you all are curious. And then lastly, out of our resources is our wastewater surveillance data. So I don't know if you all know about this, but the state has been using, I believe there are 20 utilities that are being monitored across the state. They are considered our sentinel surveillance utilities, and so we're always getting data from them throughout the year. There are a few in the Denver metro area, one in Grand Junction, some up north, I believe there's one in Greeley. So it kind of gives us a better idea of what's circulating in different areas of the state. And it's also population based, right? So where there's more people, we have more surveillance going on. But you can see here kind of what's being detected in our wastewater. So yeah, you know what wastewater is. They test it as we all go to the bathroom. So this actually gives us a really good idea of what is circulating without getting data from hospitals and stuff like that. Because sometimes people aren't going to places to get tested, especially if they're having more mild illness or maybe they don't have access to healthcare. So this will give us a better idea, because everybody goes to the bathroom, of what is going on in the state. So you can see here they track for 4 different pathogens. There is SARS-CoV-2, influenza, RSV-8, and then EVD-68. So these are all our respiratory illnesses that we're looking at. Any questions before we move forward? Well, alrighty, and then I just wanted to put in a reminder in here to get your flu vaccine. So like I said, updated flu vaccine every year, and we always want to give you all a reminder that it is flu season. So a good time to do it. And there are lots of flu vaccines available across the state for you all. Alrighty. And then I wanted to make sure to go over the multi-state Shiga toxin-producing E. coli outbreak, or STEC outbreak, that is going on across the nation. I'm sure you all have seen it in the news, and so I wanted to make sure that I was able to speak on this because we want to make sure that misinformation is not being spread, and maybe just kind of quell some fears that you might have about STEC circulating in your facilities. So, to give you all an overview, STEC stands for Shiga toxin-producing E. coli. So it is a certain type of E. coli that produces what we call the Shiga toxin. The Shiga toxin can result in more severe diarrhea, severe illness, and there's the specific toxin, Shiga toxin 1, can result in further complications if there is antibiotic usage for the treatment of STEC. So it can lead to HUS, or hemolytic uremic syndrome, which is more common among the age groups that you all are working with, so our infants and our toddlers and stuff like that. STEC is transmitted fecal orally, so without a better way to say it, it is through the consumption of typically food or water that is contaminated with fecal particles from someone who has been sick with STEC. The incubation period is about 3 to 4 days. It can be up to 10 days. So the incubation period is the time between when you would eat the food or be exposed to the bacteria and then develop your symptoms. And then the infectious period is typically as long as someone has been having diarrhea, but in certain cases it can be shed in the stool after someone's symptoms have resolved. So typically when someone tests positive for STEC in ECEs, there is exclusion criteria to exclude them until they have 2 negative stool samples that are at least 24 hours apart before they can return to ECE. STEC is actually the only E. coli that is reportable to the health department. So typically other E. coli's, so some people think about like traveler's diarrhea and stuff like that. Those cases are not reported to the health department, but STEC is, just because it results in more severe illness and can lead to complications like HUS or HUS. So to give you an idea of how STEC looks in Colorado, we do have sporadic cases of STEC that occur throughout the year. Our most common seasons that we see STEC are during the summer months, typically because we're seeing more gatherings of people, maybe people are traveling more, and people are having like barbecues and stuff like that. So when you're sharing food, typically that is the case where we see more people get sick. We have about 259 cases a year on average from 2013 to 2018 in Colorado, and 38 on average in Boulder County. And then this year, we are pretty much, I guess, on track as compared to our average from the last 8 years. But we've had 38 cases so far, but obviously it's not the end of the year yet, so we'll probably surpass the average by a little bit this year. Okay, and then this is the part that you are probably all curious about, but I'm sure you all have seen in the news that McDonald's that have their quarter pounders recalled because of a multi-state STEC outbreak. So there have been 104 cases reported. I think this was last updated, on November 13th. So as of November 13th, we've had 104 cases, 34 hospitalizations, and then 1 death. That death was in Colorado in Grand Junction. Yeah, perfect. Thank you, Martha. And then there are 14 states involved in the current STEC outbreak that is going on with McDonald's. They did find that it had to do with not the meat that was in the burger, but the slivered onions that they put on the quarter pounder. So they did find that it came from a specific farm producer, and so they did recall those onions, and we haven't seen a lot of new illness recently. There are still cases kind of trickling in because of the way that we add cases to an outbreak. So basically what happens is people get tested for STEC, and then about a week or two later, we get our culturing results back. It just takes longer to culture, it takes longer to get those results. And so then by the time they culture them and then get the whole genome sequencing, so they figure out like the DNA, and if it matches the DNA that comes from the slivered onions, then we go ahead and add them to the outbreak. So that being said, these onions have been recalled for quite a bit now. However, we are still kind of seeing cases trickle in because of that delayed testing results. And then you can see here, I added some information about demographics as well, if that's interesting to you. All right, and then this is just a map of different cases that we're seeing due to this outbreak across the country. You can see here Colorado has quite a few, and mostly in this Midwest region. As you can probably assume, these farms or producers only serve different regions because of proximity, and so that's why we're seeing more cases in this area. Let's see. Oh, and this is just an update about what cases look like as of October 22nd. We don't get a lot of updates, honestly, from the state level, and it's hard for us to pull those numbers because we don't have access to a lot of other county information. But as of October 22nd, we did have 30 cases in Colorado, 8 were hospitalized, and then we had that one death in Grand Junction. And then, as Amy had requested, there was a new multi-state STEC outbreak that was reported. I believe it was over the weekend, maybe Friday or Saturday. But it is linked to carrots, specifically organic carrots, that are being distributed. I think that Costco sells them as well, but it's among specific brands, I guess. I don't know how carrots work, but let me pull up the website. So I didn't have time to put slides together this morning because, as I said, this did get reported over the weekend. And really, from what I have read on the website, is that these carrots were available for purchase in stores only through October 23rd. So we're not really seeing them sold now. They have been pulled as of, I don't know, this like 4 weeks ago now, almost a whole month. So this is really only pertaining to people who still have these carrots in their homes. I don't know about you, but I don't typically keep my carrots for that long, especially organic ones. I feel like they don't really last as long. So it's pretty unlikely that you'd still have these in your homes. But we are seeing some cases kind of trickle in, obviously after these outbreaks get released to the media, we see more people reporting illness. So we're going to see more numbers being added to this outbreak. But as of right now, there's no harm in buying any carrots from the store. All of those carrots that were contaminated should have been taken off the shelves. Does that answer your questions, Amy? Any specific questions about the carrot outbreak? How the carrots are being contaminated? Will peeling/cooking remove the risk? Kyla, I'm not so sure about this. Like I said, it was just reported over the weekend. We haven't actually been given much information from the state yet either. All the information I have comes from the CDC website. But typically, yes, cooking will remove the risk as long as you're cooking them thoroughly. Peeling depends, right? Like there could be some cross contamination happening there, but I would say cooking should be fairly safe. Yeah, and that's kind of all I've got right now. Any other questions about the carrot outbreak or anything else? Gotcha. Okay. Amy said we were having stone soup this week and are collecting carrots for the soup. We have some parents' questions whether we should leave them out. I think that's totally up to you all. Like I said, cooking should remove the risk. However, I understand from a liability standpoint, if something was undercooked or maybe, there could be some cross-contamination happening if someone is prepping the carrots, they're touching them and then they're taking care of the children or something like that. Of course, we know that you all wash your hands, but, it can't happen. So I think that, obviously to stay on the safe side, don't use them. But if they're not organic carrots that are sold by these brands that, let's see, I can share here. And I think these are just the baby carrots, but the whole organic carrots should be the same brands as well. Yeah, should be about the same. So if you're seeing them come in from those, you can always like cross-check that, but if you want to be super safe, I would say exclude them. Yeah, no problem. Feel free to keep dropping things in the chat, and I can always come back to this if you all have any questions about it. Alrighty, I'm going to continue. All right, the last section that I have is reporting guidance, and I will kind of speed through it because I know we're running out of time. This is messy, so this first slide is about what is reportable to public health, and we'll make sure we fix this when we send them out to you. But we want to make sure that you know the difference between what is required to report to us and versus what is recommended to report to us. So what is required to report to us, as always, are one case of any notifiable disease. So that is specifically included in a list that is really updated every year by CDPHE. But varicella, so chickenpox, is included in that list. There are multiple other examples like STEC we talked about. Also measles, pertussis, stuff like that. There are other things that are not reportable to us, but we would like to be reported these situations if you are having like a cluster or an outbreak of that illness. And they could be without a diagnosis as well, right? So if you're seeing a lot of diarrhea or vomiting in one room, or maybe like a rash in a room, that might be a situation in which we'd like to hear about it. Let's see here. So any outbreaks are reportable, and then any notifiable diseases are reportable to us as well. What's recommended to report to us are any instances in which you're seeing hospitalizations. So if someone is hospitalized for a respiratory illness, that might be a situation that you'd want to report to us just so we can talk about different exclusion criteria, how we can monitor that situation to make sure other kids are not getting sick, obviously give you all preventative guidance as well. And it's kind of hard, especially if we don't have a diagnosis yet, to give super direct guidance. But of course, we can always do symptom-based guidance if you don't have a diagnosis. And then other unusual circumstances, which you might want to report to us, like we did get a question, I think it was over the summer at some point, about a cat pooping in a sandbox. And if there was any risk involved with that situation. And so we had kind of evaluated risk, thought about toxoplasmosis and stuff like that. And so there might be situations that are kind of unusual and maybe they're not specifically required to be reported to us, but we would love to know about them. One, to help you all out, but also to recognize kind of what is going on in our community. This is just kind of description of what notifiable disease is. I'm sure that many of you have heard about this if you've been on this call before, but it is a list of diseases and reporting requirements. They do vary by state, but typically they are diseases of public health interest. Because they're more contagious, they might be more severe or frequency, right? So we might see it a lot, or maybe not at all. And so these diseases typically vary by state because different states have different diseases that are endemic in those areas. And so if you worked in another state before, doesn't necessarily mean it's reportable in Colorado, but Martha can share the list of reportable diseases with you all, so you know what that looks like. I wanted to share some myths versus facts about reporting because I know that COVID-19 kind of put a bad name or gave us bad luck with public health. I know there were a few public health practices that were not necessarily beneficial for keeping your ECs open, so I wanted to make sure we address those and address those concerns. So some myths: public health will shut my facility down if I report an outbreak. Public health typically, this is the fact. Typically, public health is wanting to work with the facilities to find solutions that benefit both the facility and the public health and the health of the children in our community. And a lot of that health of the children in our community means keeping the children in school because we know that education is extremely important as well. Another myth is that outbreaks will be published to the public. During COVID-19, we did have a dashboard that, I shouldn't say we, but the state had a dashboard that publicly published any outbreaks that had been ongoing. That is no longer happening. I believe the only ones that are being published now are just numbers, and if at all, it would be among long-term care facilities like assisted living facilities, or nursing facilities and stuff like that. So no ECE outbreaks will be published online. And the last myth is, if I report an outbreak, public health will come inspect my facility. There might be situations in which we'd want to do an inspection, but it's pretty unlikely that we would go and inspect your facility following a report of, standard respiratory illness or something like that. If something were unusual, like if we thought there was an environmental exposure, so maybe there are chickens in the classroom. I know that you're not allowed to have them, but something like that, we might come inspect. But it's pretty rare in which we would inspect a facility following the report of an outbreak or cluster of disease. And a lot of this outbreak data is used for public health to understand how our community is being impacted. So it really just gives us a better idea of how we're approaching like future respiratory disease season or future enteric disease season, and when we should be starting to think about, giving prevention guidance to you all or education to our community when we see these peaks and stuff like that. And then I think this is my last slide, but I wanted to go over why reporting is important to both public health and to the community. Obviously, when you all think about public health, our biggest goal, or one of our biggest goals, is to identify and control outbreaks. We want to make sure they're not happening, but if they do, how do we kind of slow them down? How do we make sure more kids aren't getting sick? How do we make sure that that infectious number or the spread is lowered? We want to make sure there's proper treatment happening, testing, and preventative care. A lot of early diagnosis can be very helpful to preventing further spread of disease. And then along with that, right, like proper treatment, we want to make sure people are being referred to proper health care, or like STEC, there are situations in which we shouldn't be providing antibiotics, and we want to make sure that that is not happening in those instances. We do want to collect information to understand how our communities are affected. Like I said, we just really want to understand what is circulating in our community and to prepare for future outbreaks, increases of illness, future disease seasons. So a lot of it is just for us to really get a grip and understand what we are seeing in the community, and to make sure that it's not looking unusual as compared to like previous years or something like that. Because if it's increasing for several seasons at a time, we want to understand why that's happening. And yeah, I think that's it. I think this is back to Martha, maybe?
Exactly. Thank you, Sining, so much for sharing your expertise, and especially the breaking news about the carrots that we just found out about early this morning on this Monday morning. So thank you so much, Sining. Great to partner with you here at BCPH. I thought we would end with just everyday strategies to prevent the spread of illness. I think you've emphasized already so much about washing hands and washing them for 20 seconds, but we just appreciate that you continue to do that, and to clean and sanitize and disinfect. And if you're making your own bleach water, to make sure that you test to make sure that it's within the 50 to 200 parts per million, so that you're really sanitizing and stopping the spread of disease. And my daughter's studying water right now, and she said, dilution is the solution to pollution. And I feel similarly with this next section of increased fresh air. And so if you have the opportunity, if it's not too cold, but opening a window and getting some fresh air in the classroom can really help dilute the bacteria and viruses in that classroom. So next slide, please. Linda asked in the chat, thanks for asking. Linda, I have a question about the first aid kit, specifically mechanism for cleaning hands in a remote location. So yes, hand sanitizer does qualify in a remote location if soap and water is not available. As we've talked in other quarterly meetings, hand sanitizer is not effective against norovirus. And so ideally you would use soap and water, but that is fine in your first aid kit, Linda. And just a little bit of advertising here. There's free classes for childcare providers. Both Kyla and Tori are on the call. And if you're interested in having these classes come to your facility, please contact Kyla. Her email address is there. And next slide, please. And our next ECE partner meeting will be the first Monday of February from 12 to 1. And ECCBC, I think I saw Amy on the call. If you'd like to share anything.
I don't have many updates. I did want to just say thank you to everyone who attended the Parade of Classrooms a couple weekends ago, and a really special thank you to the Boulder JCC who hosted us all for a really nice lunch, and to other programs that hosted tours, Gateway Montessori, Boulder Country Day, Boulder Journey School, Aspen Center. It was really a great event, and we're looking to do this again on an annual basis. So I hope we have even more participate next year. So thank you. And also, we do have a few spots left, 3 spots left in a training that we're doing with Blue Sky Bridge on December 5th from 6 to 7 here at the Early Childhood Council offices. Is a training put on by Blue Sky Bridge for any adult working with young children who wants to empower children to feel more comfortable in talking about body safety, and participants can learn about typical behaviors in young children, how to respond to them, and what to do if you suspect abuse. We do have limited spaces for this because our space here is so small, but I also know that Blue Sky Bridge does these trainings directly for programs and families in your program. So if there aren't spots left for you to attend this, you could also connect with them to have them come to your program. And I will put the link here in the chat to that. And I think that's about it.
Thank you so much, Amy. Does anyone have any questions for Amy? If not, our other partner here today is Child Care Assistance Programs. I'm not sure if Jody is on the call today. I don't think I saw her, but if you have any CCAP questions, feel free to email Jody Sherman, and her email address is on the slide. And it's so wonderful to see so many people on the call today. If you would like to receive a professional development certificate, please email us with your first and last name and the facility name to healthece@bouldercounty.gov, and I'll work on distributing those certificates within the next week. So thank you so much for attending. And of course, we're always interested in future health topics, what you would like to learn at our quarterly meetings. So feel free also to email us at healthece@bouldercounty.gov. We're looking to put together a survey for the next quarterly meeting, just to ask you about what time would you like these meetings, these quarterly meeting or quarterly health meetings, what day of the week would be best for you, and what topics you're interested. So be looking for a survey in the new year sometime. So thank you again. And our common goal, as you know, is Boulder County Public Health partnering with ECE directors, ECE staff, and families. And our goal is to prevent the spread of disease, to keep classrooms open, and provide healthy spaces for children and teachers to learn and thrive. So thank you again for attending. And if you have any questions, Ning and I will stay on the call.